All right, so I just got back from Reynosa, Mexico, where I had a FUE hair transplant surgery done by Doctor Luis Nader, and it was 2,900 or 2,800 grafts. And I just want to record a video of my experience because there's a ton of people asking about it in the hair forums, and I figured I'd just make the video and send you all a link. And yeah, I had a great experience with Dr. Nader this morning. They picked me up here in McAllen, Texas at my hotel, free of charge. The gentleman drove me to the clinic. He spoke broken English, but really nice guy. Super fast across the border both ways. They only check your passport on the way back into the US, by the way. And once we got to the clinic, everything was ready to go. Dr. Nader was there. Took about 20 minutes to get there. And then I went with Dr. Nader into his office, and he did a consultation with me in person. And he drew the lines on my head where he was going to do the implants. And yeah, we spent about an hour, maybe an hour and a half actually, going over everything, talking about all my medical history and details regarding my hair and just general health history. He is very calm and takes plenty of time answering all your questions, and he's very informative and knowledgeable. He has some special tools, like a laser tool that he puts on your head with a straight line, where he can kind of look at the symmetry, and he draws the lines. He has two mirrors. He gives you a mirror where you can see what he's doing, and he has another mirror behind you so you can see what's happening behind your head if you're doing crown work, which I did. Yeah, he made an estimate of the number of grafts, and it was pretty close to the final. I think he said between 2,500 and 3,000, and it turned out to be almost that exactly. He drew little boxes over the areas where he is going to be implanting the hair. And then he just did some math to figure out exactly how many hairs he was going to extract. And let's see, after that, I went ahead and changed. They gave me little medical booties and a medical shirt so I wouldn't get any blood or anything on my nice shirt. And then I went into the room where they do the extraction. You're basically facing down during that extraction because they're pulling hairs from the back of your head, back and sides. That was actually the most uncomfortable part, I would say, versus the implantation chair. That's much more comfortable. You're kind of sitting on your back, leaning backwards. Anyways, you go into the extraction room, you lie down, and the most painful part of the entire day is when they inject lidocaine, I think it's called. It's like a numbing chemical into your scalp, and it basically makes your scalp completely numb. And it lasts, I would say, 1 to 3 hours each injection, because he did have to inject me. But yeah, that's the most painful part. Before that, they actually give you, we got to take a step back. They gave me a haircut, they trimmed my hair. He told me I asked him if I could keep all my hair, which was about that long, but he said it's a little bit too intrusive into this procedure. So he let me keep about, I don't know, you can tell me what that is, about 1 inch or ½ inch. But yeah, that's where I'm at right now. This is about 6 hours after the procedure, maybe 5. Anyways, he let me keep the hair on top, but they did pretty much trim the sides very short. And after that, they gave me an injection in my arm. It was a anti-inflammatory injection, or something of that nature. Something to relax. Oh no, anti-inflammatory. It's an injection, a shot they put in your arm. I don't like needles, so yeah, I didn't like that, but not a big deal. And then he gave me 3 Tic Tacs with a little pill, and he had me put them under my tongue and had that all dissolve. And that pill was for muscle relaxing, because he said it will relax the muscle on the back of my scalp so that when they're extracting the hair, it's more soft or something like that. After that, I went to the extraction room. Then he injected my scalp with the lidocaine, which is, I think, is a larger needle, but he uses a little massage gun in conjunction with it, so you can't really feel where he's putting it. You do feel the pinches. I'm really not a fan of needles, so it did hurt, but it's better than going to the dentist. I would prefer him doing that over getting a needle jabbed into my mouth. So yeah, pretty much a couple minutes after that, everything was numbed up, and he starts doing the extractions. And he has an entire team of girls and women working with him. They're all very professional, highly trained, and they are all about business. There's no messing around. They get right down to business. He extracts the hair, the follicles, one by one with his the top girl at the clinic, who's highly trained for many years. They pull out the follicles one by one. Then it goes into kind of like a, I don't know what it's called, but it goes one girl to the next, where they count they measure the hairs, they clean off any excess skin, I believe, and then they measure the hair width, and they measure the how many hairs are on the follicle, and they write everything down. So pretty much it goes through like 4 processes before it's finalized and put in these. It's like a little petri dish, and it's very organized, and it's all done by time. So the first follicle they pull out is the first follicle they're going to put in, and they also arrange them by size. So the thicker hairs go more like in the crown and kind of farther back on your hairline, and the thinner, softer hairs go on the front of the hairline, so it looks more natural. And yeah, he's just very professional about it, and I'm very confident he did a great job on me. Anyways, after that took almost 3 hours just for the extraction phase. I was definitely ready to get up at that point, and wanted to just walk around. And they did have lunch ready for me when I got up. He put it in the other room where there was a chair. He wanted me to sit down, but I figured I'm going to be sitting in that chair for the next 5 hours for the implantation of the hairs. So I decided to take it, go into the office in the front room, and stand up at the kind of reception desk and eat, so I can stretch my legs and move around a little bit, make a few phone calls. By the way, cell service there works great. I have T-Mobile. Had 4G service all day, which was nice. And then after lunch, he comes back, and he eats lunch with the girls in the back. Gives you a little free time. And then maybe 30 minutes later, after we finished with the extractions, he came back. I was almost done eating lunch. We talked a little bit more about finalizing everything on my head, the lines, and all that. And then we go into the implantation room. They have a nice lounge chair in there. I wish it was a little bit bigger, because I'm pretty tall. I'm 6'2", but it was comfortable enough. But yeah, there's a TV, large flat screen TV on the wall with Netflix, YouTube, and has Wi-Fi and everything. So then there's a little bathroom for you to use there on the side, private bathroom. I did have to get up, I would say, every hour to use the bathroom. Maybe I was drinking too much water, but it's nice to take a break throughout the procedure, because it was quite long. I think the implantation took maybe almost 4 hours, maybe longer. I don't know. It was quite a long time. And the whole process is very organized. They're very professional. The girls are basically handing him and his colleague the pens where they insert the follicles into your scalp. And it's just a very quick kind of process. They have a little, I don't know if I call it a scalpel, but it's a scalpel that is the same width as that hair. They poke a tiny little hole in your scalp, and then the pen goes in, and then they implant the follicle, and it's very quick. And then as soon as that's done, they hand the pen to the other girls, and then they hand them a new pen with a follicle in it, so it's ready to go. And there's just like one after the next. And yeah, I was able to work on my some book paperwork stuff while I was doing this. While I was sitting there, I had Netflix and YouTube videos going on in the background. I was able to, text people on my phone. So yeah, time went by fairly quick. It did get a little bit uncomfortable because the lidocaine wore off a few times, and I started getting a headache and kind of like a little bit of pain. But then I told the doctor, and he immediately stopped and apologized, and he injected the more lidocaine. So yeah, just if you go there, just be vocal if you're feeling anything. Because yeah, I was kind of just dealing with it for like half an hour. I thought it was normal, but he told me it's not normal. So he went ahead and fixed it, and I didn't feel anything after that. It was very painless. Of course, the injections when they're putting the lidocaine in hurts, but other than that, you don't really feel much of anything. I am feeling a bit now because I haven't taken my pain meds yet, but during the procedure, you don't feel the extractions. The one thing I didn't like is I did have some headphones in, like noise canceling AirPods, and you can hear when they kind of poke the pen or they're cutting through your skin. I don't know why, but even if you have your AirPods on noise canceling, you can just hear that cut, and I didn't really like the way it sounded. Even if I put my sound up higher on my phone, I can still kind of hear the sound, which is kind of like, they're cutting into your scalp, so it's kind of like you don't want to hear that. But I took off the AirPods and just started watching TV, which was a little bit better because you don't really hear it because it's not an internal sound anymore. And then I almost fell asleep a couple times. It was decently comfortable. I did have to keep adjusting myself on the chair. I wish there was maybe a footrest to put my feet up. Maybe you can bring that on your own if you go, but it depends how tall you are. Overall, yeah, pretty comfortable procedure. It is fatiguing. It is a very long procedure, so you're there all day. It's I wouldn't say it's fun, but Dr. Nader is super nice and professional, and it makes everything that much better. So really happy I did it. He, after the procedure, he had like an extra 40 or 50 grafts, something like that, and he just said, we have extra grafts, and he just went ahead and implanted them. I told him to use his artistic whatever choice and put them wherever he thought I needed it most. And I think he put them mostly kind of to thicken up these areas here, and here. And yeah, then after that, the girls, two of the girls finished, they kind of like used the saline spray to kind of finish cleaning up any blood. And then the main colleague of Dr. Nader, I forgot her name, but she basically checks the entire area again, checks almost every follicle, make sure it's pointed the right direction. She took about 30 minutes to make adjustments to certain follicles that she didn't think were perfect. So they do make sure everything is absolutely perfect before they have you get up. Once you get up, Dr. Nader tells you can rip off your medical shirt. It's just like a thin blue medical shirt thing. And then I just put on my normal shirt. I will say bring some deodorant if you go, because you're lying there all day long, and if you want to stretch your arms and stuff, it might smell, because the surgeons' faces are like right there. So if I was able to smell a little something, I'm sure they were too. So I kind of had to keep my arms closed, because I don't know, I guess I sweat a lot if I get warm. It's also, I think I sweat when I'm in a stressful situation where, I'm worried about needles and all this kind of stuff. But yeah, maybe wear some deodorant would be a suggestion. Then after that, we went into the back into his office. I put my shoes and button-up shirt back on. Definitely wear a button-up shirt. Do not wear a regular t-shirt. You don't want to pull anything over your head. You want to simply button on a shirt. So bring several button-up shirts. And yeah, he goes over the post-op procedures, which are pretty simple, but I might as well go over them because, there's a lot. First of all, he gives you antibiotic. He says to take it every 8 hours after the surgery, so 3 a day with food. There is a pain medication. He said it's similar to ibuprofen. He said take it every 8 hours with food. It's not required, but he suggests it. It's called Ketorolco. Yeah, and yeah, this will last 7 days. What he said is not necessary. Ibuprofen, the antibiotics, also last 7 days. Then he gave me this anti-inflammatory, and this also lasts until Tuesday. Right now it's Wednesday, so yeah, almost a week. There's instructions on there how to take it. He gives you a bottle of shampoo with very specific instructions on how to use it. And he gave me this bottle of saline solution, which he was very, very clear. He said it about 10 times to me. Do not refill it with saline solution, just regular water after it's finished, which will take a day or two. And spray my head every 15 minutes with this one for a couple days. I don't know if I need to do it beyond that, but I'll go over the specific instructions. He also gave me prescriptions for minoxidil, oral minoxidil, and oral finasteride, 1 milligram tablets for 90 days. And the minoxidil is called Lonatin, 10 milligram tablets. He suggested I take 2.5 milligrams to 5, so cut it in half or quarters, and it should last me about 3 months. And you can fill these in Texas apparently, because they accept Mexican prescriptions here. Okay, so post-op instructions that he gave me. Today, I'm supposed to take my medications after dinner, sleep with my head above my chest, so pretty much like what I'm doing now. Do not sleep on my side at all, and remove my cap. I did have a blue cap on. I went ahead and took it off once I got here because I don't want it to stick to the raw scalp. Okay, tomorrow, he said if I go into direct sunlight, wear a cap, and my areas of injection are going to start looking dark. So yeah, they're kind of already looking purple. He said they'll start looking purple. But then it's going to look red and then pink, and then over time it'll look like just normal skin. Okay, then tomorrow morning, starting tomorrow, spray my scalp in the surgical areas, not the donor area, but the implantation areas with the saline solution every 15 minutes. Do not spray on donor area. Take the medication every 8 hours. Yeah, I already explained that. Then starting on the third day, the day after tomorrow, remove the brown bandage, which is the one on my head right now. Get into the shower with a bucket or a cup. Do not put the shower head directly on my head. And I need to pour a bucket of lukewarm to warm water gently over my head for 5 minutes. Then I take the shampoo and make a very large ball of shampoo in my hands and put it over my head. Then with a very soft touch, rub the surgical areas like this, very softly, for 5 minutes. The goal of that is to basically start breaking up the scabs that are going to form. You want to kind of wash them away super gently. And then you can use his shampoo or like a baby shampoo, but he said some people are allergic to baby shampoo. Then after that, you spend 5 more minutes pouring lukewarm to warm water over your head again, gently, to wash it all off. So that's a 5-5-5 shower. It's basically a 15-minute shower. And he said start this on day after tomorrow. And he said do that every day for, I guess I'd do that for 3 to 5 days, maybe up to 7 days. Up to 7 to 10 days max, probably, until no more scabs are present. And he said continue to use a saline spray 3 to 5 days, or until no more scabs are present. So I think the goal is he just wants to keep everything nice and moist, and you don't want the scabs to harden too much because they'll start gripping the hair and it could pull out the follicle, which is not good. So this whole shower method, the 5-5-5 system, he said shower this way for 1 week. If there is still redness present after the first showering, you can use aloe vera gel or aloe vera extract on your scalp. Okay. For the first month, avoid sunburn to the scalp or face. So yeah, just use an umbrella or cover your head with some sort of loose hat. Do not go into a pool with chlorine. Do not go into the ocean and get salt water all over your head. And try to be very relaxed and stress-free. Another suggestion is to take 1 pill of oral Benadryl at night because it's an antihistamine, so it will remove the redness and itchiness of your scalp. If you do accidentally scratch your head and you start seeing a lot of blood flowing down all the way down to your neck, that means you may have lost a graft. And it's not a big deal because I did put in, 2,000, multiple thousands of these things in your head. So it's not a big deal, but just really try to avoid that. So yeah, those are all the instructions I got here. I do have more instructions or details about my surgery, but I'll make that in another video. Yeah, I would suggest if you're trying to get a surgery from Dr. Nader, just email them with all their emails and just say, please set a schedule. Please give me a date for a surgery, and just get on the schedule. You don't need to talk to them, talk to the doctor. You already know he's the best. Just get on the schedule, and once that happens, the doctor will eventually reach out to you directly. And he's super busy. He is hands-on. He takes 1 patient a day, Monday through Friday. And yeah, he's definitely a busy guy, and he's really focused on the patients that are actually in the clinic. So once you're on the schedule, just schedule your surgery, get out there and get it taken care of. I would highly recommend it at this point. I'm very happy about what I did. Of course, it'll take 3 to 14 months, I guess, to see the actual final result, at least a year to see the final result. But he did say he's very confident that I'm going to be very happy. So yeah, I'm excited, and I think that he's one of the best hair surgeons within a short flying distance of the US. So all these guys trying to fly to Turkey and stuff, I don't know, it's a risk. You don't know who you're going to get. I mean, you could do your research and find someone better, but I don't think you're going to find anyone that's this detailed and this hands-on with his patients. Other things I might mention is that, the price. He does offer 10% off the price if you pay, part of it in a certain way. I guess I won't say that because it's on YouTube, but he does offer a slight discount, and then he also offers $200 to $350 off for your hotel. The transportation is all paid for. So yeah, my surgery was under $6,000 for the entire thing. So that's pretty incredible considering all the quotes I've gotten in the US are at least double, triple, quadruple, or more than that. I even had one surgeon give me a quote, same number of grafts, similar 3,000, or he said 3,500. He wanted like $35,000. So it's just a huge price difference, and the value that you're getting from Dr. Nader is just incredible in my opinion. He is just experienced. He's been doing this since 2004. So what is that, 18 years, or 2002, almost 20 years. And he is a leader in the field. He's hosting his own conferences for hair restoration where he does live surgeries, and all the top hair surgeons from Central and South America and beyond come out to his conferences. Apparently he's like in charge of it. And yeah, I think if you guys have questions, you can leave me a comment, or just go in the forum and ask some questions. If you do have questions, happy to answer them. I'm trying to go over as much as I can right now. But yeah, I'm gonna get ready for bed. I did take a shower, and I was tempted to rub my head. Don't do that. Take your time, be slow. You don't want to rub your head or touch your head at all for basically the first few days. The first time I touched my head is 2 days after this. So you don't want to touch it on anything, even the pillows. You want to kind of keep it elevated, and he said to put pillows on each side so you don't accidentally roll over. But yeah, in the meantime, I'll maybe show a little bit better image. I don't know if you can see that. Oh, my head. But yeah, it's really hard to see how great of a surgery it was because it takes time to grow out. So right now you can just see where the dark area is, where the hair is all going to be grown out. That's where I pretty much was receding back to. It was pretty bad. But I haven't had my hair cut like this in years because I kept it, that long, and I would comb over, so you can kind of conceal the fact that you're balding. But now that's all going to be filled in. So I'm very excited, super happy I met Dr. Nader and chose to use his clinic. And yeah, he highly recommends everyone gets on this, well, not everyone, but he told me oral minoxidil, so you don't have to deal with that oily lotion or liquid to put on your head every day, because that's just not realistic for anyone. And he also said take the finasteride every day, and he said it has a shelf life, or I forget what it's called, but basically it stops working after 24 hours, so he recommends it a daily dosage. And then he also recommends the biotin every day. So I'm going to make another video tomorrow when I have all my other paperwork with me. It's just over there. But yeah, this is my first video, and wanted to share my experience. So I'll be posting more content soon. Thanks, guys.